Suicide First Aid, SFA. Everything you need to know. To begin, we must acknowledge that suicide is an important concern in public health. According to the World Health Organization, suicide is the second highest cause of mortality worldwide among people aged 15 to 29, accounting for 800,000 deaths worldwide every year. The effects of suicide on loved ones and communities are devastating and do not discriminate based on age, gender, race, or socioeconomic status. The goal of Suicide First Aid, SFA, training is to help people recognize the warning signs of suicidal thinking and take appropriate action to prevent further harm. In most cases, the training lasts for 2 days and consists of a series of lectures, group discussions, and hands-on exercises. Suicide First Aid courses often instruct participants in the following areas. The training provides background on suicide and suicidal behavior, including common causes and warning signs of suicide and how they may be missed. Suicide First Aid training stresses the significance of open and honest communication while working with a person who is suicidal. The participants are taught how to ask questions that are encouraging and non-threatening, as well as how to listen attentively without passing judgment. Participants in Suicide First Aid training learn to identify warning signs of suicidal ideation and how to create an intervention strategy based on those findings. When someone is having suicidal thoughts or actions, it's important to know what services and help are available to them. And Suicide First Aid training does just that. Helplines for emotional emergencies, details on available counseling, and similar resources are included below. There are many advantages to having Suicide First Aid training. The training has many benefits, one of which is the reduction of stigma surrounding mental illness and suicide. This can help make the community more accepting and understanding of those who are experiencing mental health issues. Training in providing first aid in cases of suicide can save lives. Training can help prevent suicides and reduce the number of lives lost to suicide by equipping persons with the knowledge and skills they need to recognize and respond to suicidal behavior. Additionally, there are individual benefits to receiving Suicide First Aid training. One's feeling of purpose and meaning in life can be bolstered by the training, and one's confidence in helping someone who is battling with suicidal thoughts or behaviors can be boosted. When it comes to suicide prevention and saving lives, there is no more important program than Suicide First Aid training. It's made for a diverse group of people, including those in the mental health industry, medical staff, social workers, educators, law enforcement officers, and firefighters. Those who have loved ones who are battling with suicidal thoughts or behaviors may also benefit from the training. People can learn the skills they need to help those who are suicidal right away and contribute to a more caring and accepting world by participating in this training. You can rely on Mental Health and Life for any and all information related to Suicide First Aid, SFA, and Applied Suicide Intervention Skills Training, ASIST. You found the best place to get educated and trained in the field of mental health, first aid, and suicide intervention. Thanks for watching. Like, share, and subscribe. Check out Mental Health and Life for all your training needs.